So today we are going to deal with OET speaking. And as everyone knows, when you go for OET exam, you are marked on basically two criteria. One is the language skill. You know what language skill is, but still let me remind you once again. It is your ability to talk fluently using the proper stress. For example, my name is Deepa. I can say this in many ways. My name is Deepa. In one stretch, without any voice modulation, I can also say, my name is Deepa, where I only give stress to my name. So using the right word stress, and you should not be too fast, nor should you be too slow in your speech. You have to have the right pace. All these are the areas where you are marked on your language skills. So don't hurry. So always when you go for the speaking exam, don't be in a hurry to say everything at one stretch. Instead, go slow. Because the danger is when you're very fast in the beginning, sometimes towards the middle you go very slow because probably you don't have anything else to say. Then there's a big variation in your pace of speech. So it is better to go on a medium rate. Should not be very fast, should not be very slow. Now, clinical skills. What do they mean by saying you're marked on your clinical skills? See, it is your ability to take the initiative for speaking, start the conversation, and be attentive. And also, I would say, see, now practically what I see from the students is they are only bothered with the task. They are not bothered what the patients say. But let me tell you, of course, you have to be concerned with the task, but please consider what the patients say. And you have to give them answer accordingly first and then go to the task. Okay, which you all don't do. Even if the patient says they worry, you just go to the task one by one. So what happens is becomes very dramatic and there is no personal touch in your conversation. So make sure that you respect the patient's opinion, and then you have to probably, if you have to give them a reassurance, you have to assure them, okay, there's nothing to worry. Or if they ask you any questions, please answer them and then go to the task. Okay. You also have to be very polite throughout the conversation. Say, yeah, always remember when you get information, can I have some information about your whatever disease or symptoms? Once they say the symptoms, you have to say, thank you for your information. Or when you want to take their pulse or BP or whatever, can I have your consent for the investigation or for the test? Ask them. Okay. So these are some of the general things I thought I should tell you. Then we have the warm-up sessions for the exam, then the 2 role plays. Before each role play, you have 3 minutes to prepare. What do you do during this time? Yeah, let's see. What do you do? First of all, when you get the new question paper, what do you do? Initially, you grab it and then you will go on underlining the main points, isn't it? Don't be in a hurry. Just slow down and underline the key points. Along with that, it is good to ask this question: how can I address you during the role play? It is good to ask that. Whether it's a known case or an unknown case, ask and keep. And please remember to write that person's name here on the paper, okay? Otherwise, what happens is while talking, you will come up with a different name, and then there'll be a lot of confusion. Then even you will be very worried and upset. So let us be very systematic. Huh? Okay, and once the 3 minutes are over, then you have to start the conversation, not the interlocutor. You have to say good afternoon and wish yourself. Okay. And towards the end, when you complete the task, don't finish off all of a sudden. Instead, wind up beautifully. I'm teaching in every session, wind up beautifully. Like Apart from these, do you have any other concerns? Okay, thank you. That is how you wind up beautifully. And when you say thank you towards the end, give a high pitch. Thank you instead of saying thank you, because that sounds very depressing. Because your voice is only heard, and your marks are based on your voice and not on your face. No, so you have to give an extra punch. There should be an extra energy in your talk. So total, you have a 20 minutes of exam. That in India, we know that it is usually in the afternoon. I think even in the Middle East and all, it's in the afternoon, isn't it? So please remember to say good afternoon. Yeah. How do you initiate the conversation? You can say, see, another thing that I want to ask you is sometimes if you are in the middle of a conversation, for example, suppose if a patient has come to you, you have examined the patient and you are talking after examination. You are beginning the conversation after examination. Did you understand, students, what I'm saying?
Yes,
Yes.
ma'am.
So, other day, one student asked me a doubt. Should I introduce myself then? I would say it is fine if you don't introduce. This is something that I'm telling you. So how do I know the patient's name? You can ask the patient's name during the preparation time. How can I address you during the role play? Okay, you can ask like that. And suppose if the background is you have examined the patient's teeth. Okay, and you're going to say something after that. You can say, oh, well, Anu, say, suppose if I say my name is Anu, you can straight away say, well, Anu, after examining your teeth, I find, you can straight away say like that. Then you may ask, ma'am, there is no need of introduction. Need not be, there need not be an introduction because you are in the middle of a conversation. Did everyone understand that?
Yes, ma'am.
Yeah, I think that is more natural than when the patient is opening their mouth. How can I say good morning? That's artificial. So when they are in the middle of a conversation, straight away go into it. Okay, but you have to ask the patient's name beforehand during the preparation time. Clear? Yeah.
Yes, ma'am.
Suppose, so we are going to deal with such case today. Suppose if it is a parent and a child. A parent means only one parent, either father or mother, and a child. And the child is having a surgery. How do you say? Also, just a confusion. Should you ask both the parent's name and the child's name? What do you do? If suppose if the child is below 10 years, we know that it is the parent who will take active conversation, isn't it? So it is good. So you can ask either way. You can also ask during the preparation time, how can I address the patient? Suppose if it's a child 7-year-old and I say it is Julia, you write it down. And then the task says you are talking to the parent and the child is not present. How do you say? How do you begin the conversation? Good morning. Is it Julia's mother? Or am I talking to Julia's mother? That is enough, okay? Do you understand?
Yes, ma'am.
Yes, ma'am.
I hear only one or two. Yes, ma'am. Did you all understand?
Yes, ma'am.
Yeah, otherwise, if you ask both the names, it's very confusing. Is it Julia's mom? You can ask like that. I believe in outside they ask that the patient's mom, the patient's dad. That's how they address. Okay, so it's fine that way. There is a parent and a child. We are going to do a similar one today. And if the child is below, say, 10 years or 7 years or something, the child will not be very active. He cannot contribute much about the symptoms and difficulties. The mother or one of the father or the parent will be more active. So in that case, how do you address during the role play? How do you ask the name? Should you ask the mother's name or should you ask the child's name? You can safe to ask. Suppose if the child underwent the surgery, you can say, you can ask during the preparation time, how can I address the patient? Then suppose if it's a child 10-year-old, I'll say Julia. Then how do you begin the conversation? Because the conversation is with the mother. You're discussing some of the daughter's things, discharge plan to the mother. So in that case, what do you do? What do you do? You can say, how do you introduce yourself? Good afternoon. I am Jane C, one of the registered nurse in this ward who will be attending, who will be attending your daughter today. Is it Julia's mom or is it Julia's mother? That is fine, okay? Or am I talking to Julia's mom? Did you all understand? Bindu, did you understand?
Yes, ma'am. No need to ask the name of the child. We already know. Okay, ma'am.
You should ask the child's name during the preparation time. That is enough.
Okay, ma'am. Okay, ma'am.
So this is our speaking today. Only the setting and the background. That's it. One of you read it.
Setting, hospital ward, nurse. You see the parent of a 7-year-old girl who has just had her adenoid removed and is due to be discharged. You see the parent to discuss his or her daughter's discharge and to answer the parent's questions. His or her daughter is not present.
Okay. Can I know their name, please? Who read it?
Smita.
Smita. Yeah, let's give more importance for the pronunciation. Ward, okay? Especially for Malayalis, I'll say ward. It's not ward.
Ward.
It's
Okay.
ward, okay?
Yes.
Because there is mark for pronunciation also. Okay.
Okay.
Hospital ward.
Hospital ward.
So the setting is a hospital ward, which means it is a known case, isn't it? You see, meaning you are seeing the parent. It's not parents, okay? It's only one person, the parent of a 7-year-old girl. Probably it can be a mother or it can be a father. You have to decide. Who has just had her adenoids removed, meaning this child underwent an adenoid removal just recently and is due to be discharged. Due meaning she's getting ready for discharge. She's getting ready for discharge. She's not discharged, but she will be discharged shortly. That is the meaning of due. Okay. So last 2 lines, I always remind you in every session, very, very important, because it is from there that you need to begin your conversation. You see the parent. Why have you come into this room now? What? You see the parent to discuss her daughter's discharge and to answer the parent's questions. You've come for 2 purposes actually. One is to tell that she is ready for discharge, and the next task is to answer the parent's query. They say that the daughter is not present. Okay. Did you all understand the story?
Yes.
Yes.
Yes, ma'am.
Yes, ma'am.
So how do you begin? See, same thing. I told you, no, there is a daughter. There are 2 characters here. One child, one mother. So if it is me, I would say, how can I address the patient during the role play? Then the candidate will say, probably what? Maria. Then meaning the child's name is Maria. Don't confuse it with the mother, okay? Then I can, when I'm walking into the room, what I can say, good morning or good afternoon. I am Deep Alex, one of the nurse who will be assessing your daughter today, who will be attending you today. How was your daughter feeling? You can just ask straight away, ask one question because this patient has been in the hospital. How was your daughter feeling today? Okay, yeah, that's how you begin, okay? And then you can say, am I talking or is it Maria's mom? That is how you begin. Did you all get it? Everyone?
Yes, ma'am.
Yes.
Yeah. Yeah, then read the first task.
Confirm the daughter's readiness for discharge. Post-operative recovery satisfactory. Find out if the parent has any concerns. Example, pain management, self-care after discharge, etc.
Okay. So first task, there are 2 sub-questions. One is confirm the daughter's readiness. What do you mean by confirm? See, I would like, please write it down. I want everyone to write it down. Huh? Write one sentence like this. Confirm the patient. Sorry, confirm the reason for patient's visit. It is something general I'm giving you. Huh? Not connected with this, okay? Confirm the reason for patient's visit. Confirm the reason for patient's visit. What do you mean by that? When it is given like that, which means they already this person who's in the clinic or the hospital ward knows what the reason is. And they have to confirm, well, have you come for the pre-operative assessment? Can I confirm if you have come for the pre-operative assessment? So you have to say the reason when it's confirmed. Did you all understand, students?
Yes, ma'am.
Okay, now how is it different from find out reason for patient's request to see your next sentence, write it. Find out reason for patient's request to see you. Find out reason for patient's request to see you. Did everyone write that?
Yes.
Yes, ma'am.
See, when you get a task like this, what does that mean? You don't know the reason behind the patient's visit. So you can ask, how can I help you? Or what brings you here? Now, did you understand the difference between the two?
Yes, ma'am.
Yes or no,
Ma'am.
everyone?
Yes,
Ma'am, then
yes,
for
ma'am.
the first one, then what is the question, ma'am? Then confirm the reason.
Confirm the reason and that they'll be given the bracket. Points will be given in the bracket, definitely. Which means you know that this patient has come for this. For example, confirm the reason for patient's visit, bracket, vaccination. Okay, well, can I confirm that you have come for your vaccination purpose?
Okay, ma'am.
Yeah, this is how you go. Okay, so I just want to find out I just wanted you to find out the difference between the two, because these days I can see here. Now here, now come back to the task. Confirm the patient's readiness for discharge, which means you're telling them, confirming them that the daughter is ready for discharge. Why? The reason is given in the bracket. Post-operative recovery satisfactory. So actually, you can read it straight like that. And then also you have to, the next task is find out, which means can I know? Always find out meaning can I know? If the parent has any concerns. What are the concerns? Like pain management or self-care after discharge. If she has any doubts regarding the management of a child. So how do you ask? See, you can say it in different ways. See, this child is going to be discharged. So actually it's a happy news, it's a glad news. So if you want, you can say like this. Am I talking to Maria's mom? Okay, how was your daughter feeling today? Well, I have come with a glad news today. Well, I have come with a glad news today. Your daughter is ready for discharge. As, give the explanation, as her post-operative recovery is quite satisfactory. Okay, did you all understand?
Yes,
Then I'll
ma'am.
say, I'll give my expressions. Okay, I'll leave that to me. Then immediately after, whether I respond or not is not your problem. Immediately you have to say, okay, well, do you have any other concerns regarding her? See, connect it with the patient and say, regarding pain management, no, that doesn't make sense. Regarding your daughter's pain management and self-care after discharge, please connect it with the patient. Only then there is a life in the conversation. Then I'll say my answer, okay? Oh God, she's not. Actually, I'm a little worried because, she has a bad throat, sore throat. And, whenever she speaks, it looks like, sounds like she's speaking through her nose. That is my problem. So actually, I'm giving you my worry, isn't it? Yes or no? Even after the surgery. But your task is, what is the task? Read it out. Second task.
Outline common temporary after effect of adenoidectomy, sore throat, earache, stiff jaw, change in voice, etc. Give details of recommended pain relief over-the-counter painkillers, example, paracetamol, etc.
Yeah. So actually they have given an explanation for that. But where did I end? See, remember I told you, no, you have to respect that patient's opinion or whatever they say. I'll give you examples in here. So here actually, how did the conversation end? I'm saying, oh God, I'm very, very worried because my daughter is speaking through her nose. So actually your task is, you have to say temporary, these are the temporary after effects, but I don't want you to say that. Immediately, when you listen to the concern of the mother, it is your duty to reassure her. What do you say? Well, there is absolutely nothing to worry about your daughter. She's fine. If you want, you can repeat. As I told you, her post-operative recovery is quite satisfactory. Did you all understand, everyone in this group? Did you all understand how to reassure them?
Yeah.
Yeah, this is what you don't do. This is something I'm very unhappy because you're only bothered about your task. Immediately they say, yeah, these are the temporary after effects. No, you will not get good marks. When you listen to the cry of a patient or a mother, it is your duty as a nurse to first, pacify them, reassure them, and then go to the task. Is that clear with everyone in this group?
Yes, ma'am.
Yes,
Because
ma'am.
there's no compromise, okay? There is no compromise. You have to know this. Okay, first of all, you have to say, well, I'm really sorry to hear that, but there is nothing to worry. Because as I told you earlier, use the earlier bulletin point once again. As I told you earlier, her post-operative recovery is quite satisfactory. Then you come to the task, okay? There is mark for this. How do you come to the task? You can say, outline, meaning you have to explain the common temporary after effects of adenoidectomy. You have to say that these are the common after effects after the surgery. Like usually a child may experience sore throat, all these. So how do you say? Well, I can understand your concern, but as I told you, post-operative recovery is quite satisfactory. So there's nothing to worry about. Well, let me explain that. The symptoms, or you can say, let me explain that. Let me explain some of the common temporary after effects of the surgery are adenoidectomy are sore throat, earache, stiff jaw, and change in voice. So these are the common symptoms after the surgery. So there's nothing to worry. You can add your bit. Then what do you say? Give details of recommended pain relief over-the-counter painkillers like paracetamol. Well, I should also recommend some pain relief, which is available over the counter as paracetamol. Then give an explanation, which will help to reduce her pain, or which will help to ease, EASE, ease her pain and difficulty. Then along with that, you must add, are you following me? Because you're giving us some explanation, and like a filler, you can say, are you getting me? Are you following me? Then I'll say, yeah, okay, then I'll give her some paracetamol. But, my daughter, then I'm going to say my next worry, okay? What is that? My daughter is only having liquid after the surgery. So I want to know when she can start eating proper food again, solid food again. So read the next task.
Advice on time scale for solid food, 3 days. Make recommendations on food types in the meantime. Example, easy to swallow, smooth textures, non-abrasive, etc.
Yeah. So I'm asking because she's been on liquids for some time. When can she start a solid? That is my worry. You can say, well, as a mother, please write it down. As a mother, I can understand your concern. See, it is good if you say one word like that. As a mother, I can understand your concern. I shall give you the time scale to start solid food, then you use the bracket. You should develop that in sentence. You can start giving her solids. Solids, S, that is enough. You can start giving her solids. Excuse me, I'm using a little bit of Malayalam, okay? നിങ്ങൾക്ക് അവർക്ക് solid food കൊടുക്കാൻ തുടങ്ങാം. That is what I meant, okay? Now back to English. You can start giving her solids after 3 days. Now, next task, make recommendations on food types in the meantime. In the meantime is very important. Meaning now, in between. 3 days, just before 3 days, what do you do now? I'm using Malayalam. In the edakku enda kodukkan pattunna, meantime ennu parnju ipo enda kodukkan pattunna parayamo. Okay, so you're going to say, you're going to recommend some food what can be given now. When? Before you start on solids. Okay, well, I shall recommend some food that you can give her during the meantime, or you can say, I shall recommend some food which you can give in the meantime, or you can say which you can give her now. Try to give her food, or you can give her food. You can give her food. You can give her food that is easy to swallow. Please build that into sentence. You can give her food that is easy to swallow, comma, something that has a smooth texture, something that has a smooth texture, and which is non-abrasive. Non-abrasive meaning something that does not require much grinding and chewing and lot of strain, okay? So how do you build up? Well, I would recommend that in the meantime, I mean now you can give her food that is something that is easy to swallow, something that has a smooth texture, and which is non-abrasive. Are you getting me? Did everyone follow this?
Yes, ma'am.
Yes.
Yeah.
Yes,
Then
Yes.
I will say, okay, yeah. No, shiri. Then I'll say, yeah, okay, I'll follow your advice. But I want to know one thing. I want my daughter to go back to the school tomorrow itself, because otherwise, she'll be behind. She's missed a lot of things in school. Okay, this is my opinion. But you don't agree with me. You read the task. Nasim, why are you keeping quiet? Read.
Okay, ma'am. Advice need for recovery at home, 1 week. Outline ways to reduce risk of infection. Example, avoidance of people with coughs and cold. No swimming for 3 days, 3 weeks, etc. Explore any other parents' concern, next steps, etc.
Okay. See, actually, I'm saying she wants to go. I want my daughter to go back to school the next day. Then actually, what is the task? Advice made for recovery at home. Actually, this child has to take 1 week of rest at home. That is opinion, isn't it? So actually, do you agree with what I say? Yes or no? I want an answer.
No.
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 So when say there are some situations where you cannot agree with the patient. So how do you say that? Well, I'm sorry. Write it down. Well, I'm sorry. I cannot fully agree with you. Well, I'm sorry. I cannot fully agree with you. You have to say that and only then come to the task if you want to get good marks. Okay, students, did you understand?
Yes, ma'am.
Yeah, please be very careful. These are the things you forget while speaking. Yes or no?
Yes.
Yes.
That is why we lose marks. We have to find, we have to, observe where am I going wrong? Why am I losing marks? I think it is used because you have to use these fillers also and connect it properly and speak with the patient. Yeah, you just bother about the task, and then we finish it off and then run away. That is what's happening now. Okay. Now, then you can say, well, I'm sorry, I cannot fully agree with you. Then what do you say? I would advise, I think, or you can say, I would advise that your daughter, say your daughter, let it be very personal, or you can say Maria, talk the name of the patient, not always, okay, in between. Otherwise, if you talk the name always, also it's very irritating. It's very monotonous rather. So you can say, well, I think your daughter, well, I would advise that your daughter needs complete rest for 1 week. We can say, well, I would advise that your daughter needs rest for 1 week for a full recovery. 1 week at home for a full recovery. Then outline ways to reduce risk of infection. Outline meaning explain. You can say, I shall also explain some of the ways to reduce the risk of infection. You can just explain that, read it out. I shall also explain some of the ways to reduce the risk of infection. Please avoid contact with people who have cough and cold. Again, you can say, you should avoid your daughter from people. Yeah, you can say like that. You should avoid your daughter from people with cough and cold. And kindly, or you can say, she should not be allowed to swim for at least 3 weeks to avoid infections. Are you following me? Then explore any other parent concern. Next steps, meaning what are the next steps that she should follow, or anything like any concern of that sort. You can just ask straight away like this. Well, do you have any other concerns regarding the next steps to follow? Or you don't have to say next steps. Do you have any other concern regarding regarding the next steps? That's better. Regarding the next steps, or you can say measures. Do you have any other concern regarding the measures to follow? Measures meaning endakya cheyendadu, the strategies to follow. That is what they mean. Okay. Did everyone understand?
Yes.
Yes, ma'am.
Yes.
Then I'll say, okay, then I'll come with another doubt. Okay, I'll ask, okay, I want to know if my daughter should come back to the hospital for a checkup. That is my doubt. Then you have to read the next task. One of you read it.
Confirm no follow-up appointment necessary. Stress need for medical help if daughter develops severe symptoms. Example, fever, intense pain, prolonged bleeding from mouth, etc.
Where is the disturbance coming from? Some water on the tap. Okay, please mute. Yeah. So I will say, I'll ask the nurse, when should I get my daughter for a checkup? For that, you have to giving the answer. You're giving me the answer. Confirm meaning you have to stress it and say that there is no follow-up requirement necessary. Well, definitely, confirm meaning you have to say strongly, okay? Well, definitely, your daughter does not require, please write it down, does not require any follow-up appointment. Then again use the, if you want, you can use the explanation in the beginning as, she's recovered, has a recovery is quite satisfactory. As her recovery is quite satisfactory. Now, stress need for medical help. When, if, that if is very important. Huh? If the daughter develops severe symptoms like what? Fever or intense pain, prolonged meaning long period, bleeding from the mouth, etc. If that is the case, then definitely she should approach us. That is what they say. How do you say? But at the same time, let me warn you that, or you can say, let me, at the same time, let me warn you, if your child, if your daughter develops, see, I'm just reading the task, okay? If your daughter develops severe symptoms like fever or intense pain and prolonged bleeding from the mouth, she should come back to the hospital at the earliest. Okay. Did you all understand?
Yes.
Then please remember, this is very tricky. Then I'm going to say, your task is over. Right? I'm going to say, so I'm going to say, oh, I hope my daughter will be fine and she will not develop any serious symptoms. You know how I'm going to say? I'm using a little bit of Malayalam. Oh, that's what I'm going to say. Okay. Once again in English, I'm going to say, oh, well, I hope my daughter will not develop any of the problems and I hope she'll be fine. When I say like this, I'm sure 99.99% of the Malayalis will keep quiet. The others will say something. Because there is no task. Because the Malayalis only talk for task. They won't give any extra. But please remember, when I say something like this, I'm hoping against hope. I'm saying, oh God, I hope my daughter will not have any difficulty. And when I end the conversation there, I told you it is your duties to say, definitely we can hope for the best. Please write it down. There's a special note for Malayalis. They will not say.
Don't
Okay.
misunderstand
Definitely.
Malayalis.
And hope for the best.
You know why? Because I have a sincere liking for them. No, you see, let me tell you, I'm not teasing you, because personally, I took for 4 students. 2 are Malayalis, 2 are non-Malayalis. I was waiting. They did not tell me anything. I was teaching them. Whereas the other 2 said, I'm talking from my experience. So this is not to put anyone down, okay? But I want you all to get good marks.
Yes.
So don't take it to the heart, okay? I did not say anything like that.
I'm just,
Yes,
No, ma'am.
I'm just
And see, because
what you said is true.
very true, 100% true.
If there is,
And
yes,
I want you to improve.
because there is no task. That's why we are thinking that we need to stop there. Yes.
You know why? That is why I told you. Initially, remember I told you, you have to always respect the patient's dialogue. When I say, oh God, I hope she's fine after this, definitely we can hope for the best. See, that is a beautiful dialogue. So you have to say that. And then you have to say, that is not over, okay? Then you have to say again, wind up. How do you wind up? Apart from these, do you have any other concern? Then I will say, yeah, no, you've given me a very good idea. Thank you. Then you also say, thank you. Please don't say a lot of other information. If you have any difficulty, come back to us. Yo, please don't say that, because first of all, this task is quite long. Now itself, you would have crossed 5 minutes. So don't bother to say anything, but end it beautifully without any mistakes. Okay.
Ma'am, what is the sentence, ma'am, for the last one you said?
Apart from these, see, this is
No.
one of my suggestion. Okay. You could say
No,
in
not that,
different
ma'am.
ways.
The previous one.
Definitely,
there are-
we can hope.
we can hope.
We can.
Yeah, hope for the best. Or let's
Okay.
hope for the best.
Okay.
Okay. So I think the explanation is over. Now I think we shall do a role play with including everyone. Okay. Shall we begin? I am ready. Are you all ready? Okay, one of you
Yes,
start. When you say it loudly so that everyone else can hear.
Good morning. My name is Bindu Agustin, one of the registered nurses working here in this ward. Today, I will be taking care of your daughter.
Okay.
Am I speaking to Maria's mother?
Okay, one doubt. How did you know I am Maria? My daughter is Maria.
Uh,
Tell me.
Before that, I need to ask.
Ah,
No.
that was a child. You know, or if you ask me like this, you have to. How did you know suddenly out of the blue? How did you know my daughter is Maria?
Ma'am,
So you have to.
I was thinking this is a known case, so we are supposed to know the name of the child. That's what I thought actually.
3 minutes preparation time we can ask.
Yeah. See, what she's saying is also right, isn't it? We know the patient. So actually, I'm not anyone to say you're wrong, Bindu. It's good to ask the patient's name. You can do it.
Yes, ma'am. Yes.
Yeah.
How
Okay,
can
once
I address
again.
the patient? Okay. How can I address the patient during role play?
During the
role play.
Okay, I'm Maria. She's Maria.
Good afternoon. My name is Bindu Agustin, one of the registered nurses working here in this ward. Today, I will be taking care of your daughter. Am I speaking to Maria's mother?
Yes.
How is Maria feeling today?
Yeah, actually, she's improved.
Okay, I'm happy to hear that. Now, I am here that I'm here to inform you that your daughter is ready for discharge. How are you feeling about that?
No, you have to give the explanation.
Okay. Now, I am here to tell you that your daughter is ready for the discharge because her post-operative recovery is satisfactory. Do you have any concerns related to her discharge? For example, regarding the pain management or self-care activities after discharge, like that?
Please don't say like that. For heaven's sake, don't use that, okay? Don't cut it. Okay. Then I'll say, oh, yeah, actually, if you ask me, I'm a bit worried about my daughter because she says she has a sore throat. And when she speaks, it sounds as though she's speaking from her nose. So actually, these are matters that are really worrying me. Another person, huh? Sippy, say first.
Well, I'm sorry to hear that, but absolutely nothing to worry because there are some common temporary after effects of this surgery, such as sore throat, earache, stiff jaw, and changes in voice. And I would like to give some recommendations for pain relief. You can use over-the-counter painkillers such as paracetamol, so it will easy to help your child.
It will help to reduce your child's pain.
It will reduce your child's pain.
Yeah. Or you can say it will ease her pain.
It will ease her pain.
Then what do you say? Are you getting me? Say.
Are you getting me?
Okay. See, why are the other fairies keeping quiet? Can't you all talk? Okay, then I'll say, definitely, I think I'll give her some paracetamol. But see, I have another concern because my daughter has only had liquids in the hospital for the past few days. So I would like to know when she can start having proper solid food again. What do you tell about that?
Okay.
Well, as a mother,
As a mother, I understand your concern.
Say, Sarah.
Well, as a mother, I can understand your concern. So I shall give you a time scale when to start solid food. So you can start your solid food after 3 days. You can start with some food which is easy to swallow, like
No,
smoothies.
no. In between, like now, currently, you can give us something. Say in the meantime, they say. Okay, say like that.
Okay, in the mean, you can start
In the
with
in the meantime.
in the meantime. Sorry. In the meantime, you can start with some food which is easy to swallow, which is smooth in textures, and which is non-abrasive, like porridge or smoothie. So, are you getting me?
Yeah. Yes. Okay, that's good. Sarah, you always use so in between, like a support. Don't use it, okay? Okay, well, I'll go by your advice. I'll follow your advice. But I want to know if, I want my daughter to go back to the school tomorrow itself, because otherwise she will be behind at school because she has missed a lot of classes in back school. So what do you say about that?
Advice that you have to- Well, I'm sorry, I cannot fully.
Someone else who has not said.
Sorry, I cannot agree.
Well, I am sorry.
Mm.
Well, I am sorry. I cannot fully agree with you. I would advise that your daughter needs complete rest for 1 week at home for a full recovery.
Okay.
I shall also explain some of the ways to reduce risk of infection. You should avoid your daughter from people with cough or cold. She is not allowed to swim at least 3 weeks to avoid infection. Are you following me?
Okay. Yeah, can someone take up from there?
Okay. Do you have any other concern regarding the next step?
Next steps to be followed. Say. The same person repeat.
Do you have any other concern regarding the next step to be followed?
Steps, more than one. The next steps to be followed.
Steps to be followed.
To be followed. Please write it down. ചെയ്യേണ്ടതായിട്ട് വല്ല കാര്യങ്ങളെ കുറിച്ച് ഡൗട്ട് ഉണ്ടോ? Okay. Then I'll say, okay, well, I would like to know if I need to bring my daughter back to the hospital for a checkup. Should I?
Definitely, your doctor does not require any follow-up appointment as her recovery is quite satisfactory.
Okay.
But at the same time, let me warn you, if your daughter develops symptoms like fever, intense pain, prolonged bleeding from mouth, she
definitely
she should come back to the hospital at the earliest.
Yeah, definitely we need to give stress and say definitely she has to come back. Yeah, that's good. Okay. Yeah, I hope my daughter will be fine, and I hope she will not develop any other serious symptoms.
Definitely, we can hope for the best.
Yes.
Yeah, definitely.
We can hope for the best.
Can one of you say more clearly?
Definitely, we hope for the best.
We can hope. We hope, Allah. We can hope for the best. English, we can. Let's hope for the best. Okay, now how do you wind up?
Apart from this, do you have any other concerns?
No, actually, you give me a very good idea, and thank you so much.
Well, thank you.
Yeah, that is how you wind up. Okay, girls, if you say, girls and Johnsy also, one boy. If you say like this, I'm guaranteeing that you'll get 400 and above. Yes or no?
Yeah.
Yes or no?
Yeah.
Yes,
Yes.
ma'am.
Yes,
Ma'am,
because we have
ma'am.
not missed out anything. And you all are saying it so beautifully. I'm so happy. Yeah? Everyone is saying good. Because you all are very attentive, you're taking notes. That's good. So this is our level, okay? Should be a benchmark. We should not come down. Don't use unnecessary like that. I think I'll put a video alone for this. What are the things to avoid? Like that.
Yes,
So
ma'am.
please, for heaven's sake, don't use such casual slangs, okay? Because that'll, erase the seriousness of the speaking, and it will reduce the professionalism also. Okay.
Apart from
Sorry.
this, apart from this,
Okay. Apart from these,
Apart from this, do you have any other
other
concerns?
concerns?
not apart from this, sir, we have answered a lot of tasks.
Yes.
Apart from
These.
CHESC, these, do you
Yes.
have any other concern? See, this is one way of winding up. I'm not saying that this is the only way, but this is one way of winding up. Okay, smoothly. John C, did you understand?
Yes, ma'am.
We should start again in the
Yes.
same energy,
Ma'am,
John C. We should
Yeah,
start
next day
speaking in the
I
same
recommend you
energy.
to next day you have to conduct it Malayalam session. Next day you have to take into Malayalam session.
What should I say in Malayalam? I'm talking both Malayalam and English, and I'm sure all the non-Malayalis also understand when I say.
Test will be in English, so you need to practice in English.
Yeah, see, John, see, they are saying that you have to speak in English. I think I'm going to
Okay.
Yeah,
see,
I will make you say.
can,
Yeah,
ma'am, can I ask one more doubt?
yeah.
Ma'am, the last sentence, apart from this, do you have any other concerns? Then after that, patient will reply something. Then how we will conclude, ma'am?
Then don't say anything else. Okay, but then definitely if the task is all over, they'll say, no, thank you. You have cleared all my doubts. Then you can just end up by saying, thank you. Don't ask unnecessary
Thank
questions
you.
again, okay? Because you know what, when the students try to say something, they go wrong grammar, and again, lot of confusion. So be safe and end it beautiful and run out. Okay, that is
Yes,
safe. Yeah. So Sam, I hope this was useful for you.
Yes.
definitely, ma'am.
Don't expect your cooperative interlocutor.
Yes,
Yes,
ma'am.
yes.
But you don't have to be bothered. You just be normal, have a professional style of talking, and then go out. That's enough. So because she was serious, it should not affect your speaking. Just because your interlocutor was serious, you got scared. That is no reason. Because you have crossed that age. You're not young girls, okay? So you have to, be strong. You don't have to depend on them. But you be very sweet and talk nicely like this, then you don't have to be scared of anything. Okay. And please understand, they are not the ones who are putting marks. They're simply sitting there for the dialogue. Huh? They are not putting the marks. So why should you be scared of them? Okay then. Bye bye. Next Friday we'll be doing another new letter, which you all have not done. I will take. Okay, till then, bye.
Thank you.